Welcome to this episode of ALAB Radio Trip to the Future. I am Rupert, and today we will immerse ourselves into the world of what most people might consider gross, but very, very much essential to study and explore, for they bring great impact to humans and to the environment. In this episode, we will be tackling the field of parasitology, the field that focuses on investigating parasites that greatly affect humans and provide sound solutions to these health problems. Today, we are lucky to have the Center Director of the Southeast Asian Ministers of Education Tropical Medicine, Regional Center for Public Health, currently a professor and the Dean of the College of Public Health. We are delighted to welcome our very own Dean Vicente Y. Belisario Jr., Doctor of Medicine and Master of Tropical Medicine and Hygiene. Hello, Doc June. Welcome to the show.
Maraming salamat and thanks for this opportunity to converse with all of you through ALAB Radio.
Yes, Doc. Thank you po for taking the time to be with us today despite your, I know, very busy schedule. I'm sure I'm not the only one excited to learn more about the different opportunities there in this field. But before that, Doc, since not all of our viewers and listeners are from the college, can you tell us a bit about yourselves?
Okay, so tasked to lead CPH up to 2022. Yours truly is a medical doctor by training. My undergrad was not a usual pre-med course. No, it was Bachelor of Arts in Humanities pre-medicine. There used to be a course like that in UP Diliman. I was originally a biology graduate that I said, I don't like all science. Is there something I can do that is not all science that might also lead to medicine? And then came that new course, AB Humanities Pre-Med. So we had arts and music, we had literature, we had social science, psychology, sociology. Wonderful, because really human existence is not just science. I trained in the UP PGH, in internal medicine. But close to 1 year of training, I decided I wanted to do something that is not too popular, but much more needed. Because there will be many internists or internal medicine specialists, because there's a mass production of internists in this country. What is it that I can do that is not popular, but is much needed? Then came that opening in the College of Public Health. The faculty position that was open was in parasitology. The attraction was the faculty to be hired was going to teach in the College of Medicine and will help also in teaching public health. Now, public health is a wonderful field. Now, one of my favorites in medicine was the subject called community health. Most of my classmates hated it, but I was one of a few who enjoyed it. So the community health subject I enjoyed. I was even appointed liaison officer. Maybe that's part of the destiny. I was appointed student liaison officer for community health. And at that time, who was teaching community health in the College of Medicine? It was the College of Public Health. So that was my first exposure with the College of Public Health. The College of Public Health also was my favorite place. It was my refuge. The restrooms of College of Public Health at that time were the best restrooms in UP Manila, believe it or not, but not anymore. And then later on, the opening in parasitology, I worked for 1.5 years. I was very close with the students, because I like to deal with the students. I think part of me really is a teacher. Yung parang bata pa ako, naglalaro na ako na teacher-teacheran eh. But of course, the thinking at that time was, wag kang mag-teacher kasi it does not take care of you well. But not if you're working in UP. In UP naman, you don't only teach, you also do research. You also do public service. I still see patients. I have my little practice in Laguna. Believe it or not, I see patients. I'm a family physician when I'm back in Laguna. So, Department of Parasitology, so I had to study the worms more in depth. And then later on, a scholarship comes. That's what happens when you work in UP. You show dedication and commitment. UP is going to send you abroad to study. So then comes a fellowship from the World Health Organization. There's a slot. And Belisario was number 2 in the list. I chose a program. I wanted tropical medicine. What is tropical medicine? These are the parasites. and the diseases of the poor in the tropics. Who likes to study the diseases of the poor? Not many people. Kasi yun nga gusto ko eh. I said, I don't want to become an internist anymore. I want to do something not popular but much needed. And it was public health, it was tropical medicine, it was parasitology. So God willing, I was sent abroad. I went to the US, tropical medicine. Then I met my professor, John Cross. My gosh, my idol, second father to me. John Cross was the discoverer of the life cycle of Capillaria philippinensis. He worked in the Philippines for about a decade, based in San Lazaro Hospital. There was a Naval Medical Research Unit there, operated by the United States. The capillariasis outbreak happened in the 1960s. Dr. Cross was the scientist in that lab, and he was the one who investigated the outbreak of capillariasis. Worked with people from UP, worked with people from the field, from the DOH. They discovered the life cycle of capillaria. He became my teacher in the US. I miss him a lot because he is really one of the key people in my life that excited me, that inspired me to focus on parasitology. Before I went home from the US, I told him, Dr. Cross, what do you think? Should I do PhD? He said, no, you don't need PhD. You're already a medical doctor. Why do you need a PhD? You're already a doctor. You're trained well in tropical medicine, in parasitology. Go home, practice parasitology, do tropical medicine. Don't forget to continue seeing patients. And one day, you're going to be the expert in the Philippines. So si Dr. Cross, parang di lang ang young people. This is a tip I share with you. Don't forget to listen to the more senior people because they have so much wisdom. Okay, choose people you listen to and listen to the people with wisdom you admire because they will be the ones also helping you succeed in life.
Yes,
okay.
Udo.
So that's how I ended up in and then of course coming back here, it's Dr. Cross na naman. June, you apply for this. Binigyan niya ako ng call for proposal for a grant, WHO, to study filariasis. That brought me to Sorsogon, to your region, Rupert. Sabi ko, Dr. Cross, will I qualify here? Will you think my proposal will be approved? No, you're qualified. You apply. And then I applied. I was given my first grant from WHO in US dollars. So that allowed me to start building my research team, and that allowed us to go to Sorsogon and help the many people there and write about what we have studied and continue to work in research so many years up to now. Pati yung Paragonimus, natuto ko how to write a grant there, and no more turning back. It was never the same because these people showed me the way, blessed with opportunities. UP College of Public Health is not a perfect place, but it is an excellent stage for career growth and development. No more turning back because there's so much support, especially that the parasitic diseases are listed in the Sustainable Development Goals targeted for 2030. We have to work towards controlling, if not eliminating, many of these diseases of the poor. And NTDs are explicitly stated in the Sustainable Development Goals. They are the infectious diseases of poverty. It's a very pro-poor specialty. If you're helping the poor, that gives you so many points to get to heaven. Kasi you're helping the poor, parang a missionary. But you're doing work that you need to do. Hindi naman ito missionary work. No? There is funding for you. There is extra income. We can talk about that later on. You're helping other young people who are helping you in your work. You're training young people who are working with you. You're serving communities. Talagang it's a nice package. Our work has allowed us to reach the unreached. Ewan ko kung naikwento ko when I was talking about Paragonimayasis, we crossed rivers because there is no bridge. There is a river that the 4x4 vehicle has to cross. The vehicle will need to cross the river 5 times. And when you get there after an hour, my gosh, the people have their early morning sputum waiting for you for diagnosis and treatment because they've been suffering from chronic cough as if they have tuberculosis. And then you're able to treat some or many of them. My gosh, you will never be forgotten by these people for as long as they live. Because all this time, They have been neglected. So reaching the unreached. And then we're able to serve the underserved. Wonderful. And then the researches. O di ito na, research na. Ipapublish mo na ngayon yan. O mamaya, makakatanggap ka na ng imbitasyon. Dr. Belisario, we're inviting you to travel to Bangkok. Please present your paper. Paano ka nakilala? Kasi nag-publish ka ng papel, nabasa nila eh. One day, I get an invitation. Dr. Belisario, you're appointed to serve in the research strengthening group of WHO TDR. You will travel to Geneva. Your term is for 3 years. You go there once or twice a year. I asked the people in Geneva, how was I selected? I never applied for this. No, this is by invitation. We got to know you because of your publication. So really, guys, aim to publish. Because your publications will define the kind of expertise you have. And number 2, it will link you to the parties that will need your expertise. Can you imagine that? Advising WHO. If you're advising WHO, you're already helping the world and not just the Philippines. Nakakatuwa talaga siya. Kaya sabi ko nga, you're highly encouraged. Think of CPH as your future home for your career. Kasi grabe siya. Public health, lalo pa ngayon na pandemic, ang daming opportunities. So, alam niyo ba, tayo ang kinukonsulta ng Commission Higher Education for reopening of higher education institutions. It's CPH being mentioned there. Hindi na lang ito parasitology. Then comes the call, Belisario, it's time to serve the college. My gosh, how can I say no? And then of course, part of it is divine providence. Don't forget, alam niyo ang tao is not only body and mind. I strongly believe body, mind, heart, spirit. May spirit. And there is something divine that takes us to where we're supposed to go. So be open to that, young people.
Thank you so much for telling us that very insightful journey of yours. How was your experience going to Sorsogon for filariasis, for tackling filariasis, for tackling paragonimiasis, and for going to, let's say, Tacloban, for schistosomiasis? And I think also, Doc, you may probably can answer this already, the question whether how you were able to love parasites, really, because believe it or not, a lot of people would actually consider parasites as somehow a very extremely unpleasant creature that nobody would want to touch, nor see, nor have in their body. So how were you able to learn to love this field?
Sorsogon was most challenging because I was really new in this work of doing research in the field, Very little experience. That's why I needed guidance from my seniors in the Department of Parasitology. My senior at that time was Dr. Wilfred Chu. He was my teacher when I was in medicine, and then he was my department chair when I was in CPH. He was the one who gave me tips on how to do project management, how to handle the money coming from the funding agency, the field work, etc., etc. Dr. Edito Garcia was also instrumental, former dean. You see the pictures. If you go to CPH, there is a wall there now dedicated to all the deans of the CPH from then up to now. So Sorsogon was difficult, NPA infested. I didn't know how to navigate. You had to go up to the mountain to see the patients because they were also hiding. They were not socializing. Because we needed to interview them. Part of our work was social science, with Dr. Lariosa of Department of Community Health at that time. You need to have people in your team who have good sense of humor. Kasi kahit mahirap ang buhay, even as students, what made me survive in med school, tawanan kami ng tawanan nung aking mga ka-groupmate na matatawanin. So that, kahit napalpak, kahit na mahirap, kahit wala kaming tulog, tawanan pa rin kami ng tawanan. Laughter really is a good way of coping with anxiety and stress and possibly depression. Remember that, ito na. First barangay namin. Ang daming ulo, Rupert. Ang daming ulo, ang daming nakikita. Sabi ko, patay, Ma'am Winnie. Ang daming tao, lahat ng plema niyan, i-examine namin. Dami. Tapos, yung plema nakalagay dun sa gravy container na maliliit na ganyan. So nakasalansan na yung mga plema kasi it has to be early morning sputum. Submit the early morning sputum na. The UP team will come and process. Wait for the results. Before you go home, noon time after lunch, meron ng resulta. Okay. Positive or negative ka, bibigyan ka ng gamot libre. So itong si Professor De Leon, tanggal niya yung salamin niya na ganyan. Kasi matanda na siya. Sure, at that time, she was already late 50s. Tanggal niya salamin niya. Sabi niya, Sir, tawag sa akin, Sir, ang daming puto. Akala niya, yung mga lalagyan ng graving maliliit, puto nakasalansan doon sa mesa. Sabi ko, Ma'am Willie, hindi ho puto yun. Sputum cup, ang dami natin So ako naman, ang reflection ko dyan dito, don't forget to reflect. Ang reflection ko dyan, my gosh, I feel so overwhelmed. Bakit? Each of those sputum containers contains sputum that must be examined. Bawal na bawal sa team ko, Rupert. Nagtatapo ng specimen. Hindi pwede yan. Kaya merong isang RA, tinapon yung specimen ng makanglaw. Tinanggal ko siya. Hindi ka na pwede sa team ko. Kasi ang rule, lahat ng examine all. You cannot be judging based on the appearance. I'm not going to examine this because it looks like saliva. Who called my attention? One of the younger RA, she was a graduate of Adventist University. Nag-apply sa akin. Kinuha ko medtech, magaling. Sabi nung medtech, sabi niya, Sir, meron ba ho kayong order na pagkamukhang laway, wag hindi natin i-examine? Sabi ko, hindi. Examine. Kasi ho, si ate ganito, tinapon ho yung mukhang laway. Nag-testing ho ako ng mukhang laway, nag-positive ho eh. You see how much disservice that is? The person comes, submits the sputum, and you don't examine the sputum. What do you tell that person? Tell me. Sabi mo, I decided to throw your sputum because it looks like saliva. Ano ka ba? Do you have microscopic eyes na hindi mo nakikita mong walang paragonimus yun? Each and every plema that is submitted there, because of a neglected disease, carries an unwritten message, guys. What is the unwritten message? The unwritten message is, please help me. And here you are, you're not going to examine it. So please help me. So talagang we owe it to ourselves, and that's part of the training of a health worker. You're responsible. You don't need somebody watching over you. You have your own resolve to try to do a good job. Not perfect. I'm far from perfect. I am not a saint. No, but we continue to improve day by day, with the help of everybody, including the Almighty. Punta kami sa isang town doon, New Corellia, in Davao del Norte. Marami hudok doon na inuubo na hindi gumagaling. Punta kami doon. We were doing stool exam. Isiningit nila, pwede ba ho pati sputum na rin? Sabi ko, sige na nga, sama na natin, nandito na tayo eh. Pagdating namin doon, dami na namang ulo, dami na naman tao. Sabi ko, ano ba naman dito? Wala ba dumadating dito mga doctor, health worker? Pag dumadating tayo, akala mo, never sila nakakita ng doktor. Mid-morning, comes a lola, probably in her early 70s, walking slowly like that, bringing along with her the cap of the Coca-Cola bottle, yung screw cap na ganyan. Lumuwa siya ng plema doon, na may dugo-dugo, na umaapaw yung plema niya doon sa daliri niya, kasi nga ang liit-liit naman nung screw cap ng Coca-Cola. And she was walking slowly towards me and telling me, pa-examine naman ng plema ko. But really, the reflection there is so many people neglected. When you do research, you have to do something for these people who help you do research. You have to go back, tell them the results. Positive po kayo, negative. Kung positive ka, kailangan ng gamot. Negative po kayo, hindi ho sure na negative talaga kayo, submit pa kayo ng plema bukas. So it carries with it a huge responsibility. And that's why healthcare, medicine, public health is not for people lacking in dedication. It's not loving the parasites. It's really loving to serve because of your love for others. I don't love parasites, but because the call is for me to understand parasitology so that I can help the people, I must embrace parasitology and understand and know parasitology and connect with people who are good in parasitology, the resources in parasitology that will help me do my job together with my team. So it's not really loving the parasites, but loving the people you serve. Because when you serve them, you love them eh. If you love God, you will love others. Kaya minsan, mali ang pagpapakilala sa akin, pinapakilala ako occasionally, the worm doctor of the Philippines. No, I'm not the worm doctor. Because I'm the doctor of the people. No, I'm getting rid of the worms. So what do you need to call me? I am the worm buster. I don't love the worms. I have to understand it and know it well. Yeah, you can love your work, so that you can give it your all, to the best of your ability.
Well, thank you so much, Doc, for that very inspiring story, filled with challenges, but filled with hope and filled with insights. It's interesting to ask or to know whether there would still be opportunities in this field for those who graduate under population health track.
You can still do population health and be talking about parasitic diseases. In other words, epidemiology by statistics of parasitology is population health. Health policy of parasite control and elimination is population health. So don't ever think that it's strictly MLS. That when you take parasitology, you're going to be doing microscopy. Modern public health goes beyond microscopy. There's a misunderstanding that we need to correct. And thank you for asking that question. Yes, you can do population health. The content can still be parasitology. Because in population health, there's such a thing as the need for content expertise. The content expertise is not in health policy, health promo, or epibiostat. The content expertise is in micro, para, nutri, environmental, and occupational health. So you young people should realize that even if you become an expert in a field, you don't know everything. So you have to collaborate and connect. And then you're not ashamed to ask help. You know what's a requirement in public health? Humility. That you don't know everything. Doon sa Leyte, sa Mindanao, hanggang ngayon, may namamatay ng sisto. Bakit hindi binabanggit? Kasi sakit ng pobre yan eh. And who's going to represent these people? I think the people we carry now the task of speaking for them. You use now science, and that's the research in public health. Use science now to speak for these people, to call attention to these people. So BSPH students have the power to actually contribute to meaningful work post-graduation. Where are you being led? Because I'm just human. I am not the full driver of my life. I feel that there is a force that is not seen but is felt that brings us where we're supposed to go. You have to immerse yourself. You have to discuss and converse with people. And then you have to see it for yourself, so that you will realize this is something I want to do. Highfalutin, sophisticated ba ginagawa namin? Hindi. It's just trying to do simple things that mean a lot, especially for the poorest of the poor. That makes it really fulfilling. Having an attitude na lifelong learning is important. It never stops. You graduate from BSPH, you graduate from postgrad. Okay, public health is inherently collaborative. There is always somebody better than you. Remember that. That's part of the humility. Always somebody better than you. Inspiration. How can we become an inspiration to others is something we need to pray for and work on, so that you have the power. I may not have the physical power, but if it is knowledge, attitude, or inspiration that I am sharing, that is also power.
But I think let's also dive into some practical aspects of this field. Specifically, let's go to topics on salary, topics on money, topics on finance. So we can deny that salary is a big part of that decision. So can you give us an idea on the financial aspects of working in the field of parasitology?
Okay, it was challenging at the start kasi talagang the challenges come early. But remember, the challenges are not permanent. The major challenge was having to experience residency in PGH, my first year internal medicine, without a salary. Can you imagine that? There was a time, poorly managed Philippines at that time, and poorly managed PGH, where first-year residents, the workhorse of the whole hospital, lawit na andila mo sa katatrabaho, walang sweldo, tiisin mo. Then comes being a faculty in the CPH, meron kaming salary. Of course, it's better now. We have a salary. But the salary is not something worth talking about with my parents or my friends because it's really, really, really low. At that time, government employees were paid so low, kawawa. And then when you do research and when you do projects, you earn extra. So natutuwa ka kasi may konting incentive, We were doing research on malaria, kasama namin yung buong department, nakakatanggap kami ng additional We call it honorarium. But there are perks working with UP. Example, you're going to be sent abroad to attend meetings free of charge. All expenses paid. You learn many things. You get more inspiration kasi you learn new things. You meet new people. Some of the people who will be guardian angels you will meet in some of these meetings. No? So collaborative spirit is something that you should inculcate. Learn to work as a team member. Bottom line answer, yes, it can be promising if you work hard and if you're good in your field, you do your work well, you will be noticed, you will be taken care of.
Yes, well, thank you so much po for that. I think you've given us quite a lot of pieces of advice about this field. But I think just to end po, I just want to ask, looking back from a lot of things that you have achieved, a lot of experiences, would you have changed anything?
Like ko wala. Kasi talagang ano rin yung ano ako mabilis ako mag-accept. No? Things don't happen the way you want it, you accept it. Because it's not the end of the world. No? When a door closes, another one opens. Or more doors open. No? That's why you, young people, you're the hope of this nation. You're the hope of the poorest of the poor, the underserved, the unreached. No? So sana, keep that in mind and heart and look for opportunities where you'll be able to do those things, but you should be well taken care of.
Thank you so much, Doc Belisario, for that. That was a very inspiring, eye-opening conversation with Dean Belisario. Thank you so much, Doc, for giving us your time and sharing with us your knowledge on the career opportunities in the field of parasitology. I'm sure our viewers have learned a lot from you. And to end this has been Rupert for ALAB Radio. Till next week, may continue to seek your fire within.
ALAB Radio Trip to the Future is an initiative by ALAB College of Public Health in coordination with UP Manila CPH Student Council and UP Hygiene Society. This program is in partnership with 𝙬𝙧𝙤𝙗𝙃, University of the Philippines, Manila, Alliance of Public Health Athletes, CPH Hydro, Public Health Artists Circle, Progressive and Responsive Organization of Pharmacy, Industrial Pharmacy Honor Society UPCP, 𝗲𝙬𝙗, Staff CPH, in cooperation with UP Biology Majors Association, UP Manila Classical Ensemble, UPM Peer Empowering Peer Society, together with our media partners, SparkUp and WhenInManila.com.